Welcome everyone, people in India. This evening, we are honored to have great personalities from Indian healthcare system, especially in the Telugu states. Dr. Guruvareddy Garu from Sunshine Hospitals, Dr. Hariprasad Garu from Apollo Hospitals, Dr. Ramesh Babu Garu from Ayush Hospitals, and also shortly, Dr. Satya Prasad Garu from Bhimavaram, who is a pulmonologist, and Megastar Chiranjeevi Garu is a very close friend. He's going to join, and also as a special guest and as a person with social awareness, Mr. R.P. Patnaik Garu, our famous music director, he's also going to join because he's very much interested in social topics and how to help people. So without wasting time, let's jump into the topic. Our topic is Save the Saviours. How to prevent violence against doctors, the medical community, the hospitals, who have been helping. అంటే మనందరినీ కూడా చాలా జాగ్రత్తగా చూసుకుంటూ, ఎస్పెషల్లీ ఈ కోవిడ్ టైంలో రాత్రనక పగలనక కష్టపడి డాక్టర్స్ వాళ్ళ మీద అటాక్స్ జరగడం అనేది నాకు చాలా బాధ అనిపించింది. యాక్చువల్గా దాదాపుగా ఇదంతా చేయడానికి కారణం ఒక 3.5-4 months బ్యాక్ నేను యుఎస్లో ప్రాక్టీస్ చేస్తూ ఉంటాను, శాన్ డియాగో, కాలిఫోర్నియా. ప్రాక్టీస్ ఇంటర్నల్ మెడిసిన్ అండ్ ఐమ్ ఆల్సో స్ట్రెస్ మేనేజ్మెంట్ కన్సల్టెంట్. సో ఒక 3 to 4 months బ్యాక్ నాకు ఒక ఫోన్ కాల్ వచ్చింది మా మదర్ దగ్గర నుండి. ఈ కోవిడ్ సమయంలో ఏంటి కన్ఫ్యూజన్, కొంతమంది మాస్క్ పెట్టుకోమన్నారు, పెట్టుకోవద్దంటున్నారు, కొంతమంది మజ్జిగ పూస్తే తాగితే సరిపోతుంది అంటున్నారు, కొంతమంది ఏమో అసలు వ్యాక్సిన్ అక్కర్లేదు అంటున్నారు. అంటే ఆ కన్ఫ్యూజన్ క్లియర్ చేయడానికి అంటూ సరే మా మదర్తో గంట సేపు మాట్లాడాను. ఆ తర్వాత వెంటనే నేను అనుకున్నాను అనమాట, అరే వీడికైతే రోజు మాట్లాడతాను, మరి మిగతా పరిస్థితి ఏంటి అని చెప్పి. Then I started Zoom calls. I started doing Zoom calls every day, morning like 6 a.m. for me, 6:30 p.m. for Indian time, so that people can learn about COVID. Of course, Indian doctors are helping, but we needed all help. So I want to do something too. So ee process lone I encountered అంటే ఒక పరుచూరి మల్లిక్ గారు కొన్ని అంటం అటాక్స్ జరగడం కమ్యూనిటీ, డాక్టర్స్ కమ్యూనిటీ మీద. అరే ఏంటి ఇలా జరుగుతుంది? సో దెన్ ఆయన ఒక 57 questions అడగడం. సో లెట్ మీ ఆన్సర్ దెమ్ అని చెప్పి యాక్చువల్గా ఐ డిడ్ ఇంటర్వ్యూ విత్ హిమ్ అండ్ ఆన్సర్డ్ ఆల్ దోస్ క్వశ్చన్స్ అండ్ ట్రై టు కామ్ ద సిచ్యువేషన్. నౌ then I realized it is not just one isolated incident. The whole India, there are so many things that are happening against doctors, against medical communities. And I know personally many of the doctors, my classmates gani, megita people gani, how much dedication that they work with. So ekkado konni tappu jaragadam valla andarni kuda antam right kaadu. For the mistake of the few, we should not judge the whole anedi point akkada. So dantoti Save the Saviours program okati cheddam ani cheppi మొదలు పెట్టడం జరిగింది. అండ్ ఐఎమ్ వెరీ థ్రిల్డ్ టు బి ఏబుల్ టు స్పీక్ విత్ వేరియస్ పర్సనాలిటీస్ ఓవర్ ద పాస్ట్ 2 to 3 months. And today, now I'm going to hand over the mic to our eminent personalities and doctors here. Welcome, Dr. Satya Prasad Garu. Thank you for joining us.
Thank you.
And the main question is, sir, I will ask the first question to Dr. Hariprasad Garu. But anyone can interrupt and join and is the conversation, So, sir, me experience, you have so much experience, you have taken the emergency department in Apollo, and as an administrator of Apollo, you have taken to the great heights, and every day you see so many things as a physician, as an administrator. So give me your perspective, sir. What do you think about this whole situation, about violence against doctors and medical communities?
I'll start with a story which would probably set the perspective right. I used to play cricket and was a Ranji Trophy player and was an opening batsman. So thank you for giving me an opportunity. Because often the openers set the tone for the rest of the innings for the team. So probably I'll set the tone for the rest of the innings for this discussion.
Yes.
I'll tell you the story of an 80-year-old gentleman who came to the emergency in a collapsed state. And very soon they diagnosed that he had a dissection of the aorta and was sinking rapidly. So the family was counseled, the costs were explained, everything was done, and informed consent was taken. And within hours, he was in the operation theater. Some 15, 16 bottles of blood were administered. Everything was done. He was operated. But on the fourth day, he died of acute renal failure. Now, each day the patient was a family was being counseled and was being told about the patient's condition, was being told about the cost, was being told about everything. But once the patient was expired and the family was told about it, some outsiders gathered in and said the bill was about 2.5, 3 lakhs, I guess. They killed the patient, they operated and killed the patient and stuff like that, and started creating a big hue and cry. And the funny thing was, within seconds, the entire media was there. And it became a big, huge pressure thing. And ultimately, when the family was asked, they said, yes, sir, you did everything, you informed everything to us. These people have come in and they said this. So the ultimate goal was just to not pay the bill. That was the ultimate goal of doing the whole tamasha. And I think there is a lot of contribution of multiple stakeholders in the current situation. Vaidya Narayana Hari annaru. ఇప్పుడు గురువారెడ్డి గారు ఎంత మంచి సర్జరీ చేసి ఎంత బాగా నడిపించినా కానీ ఆ మాట అనట్లేదు. ఇప్పుడు గురువారెడ్డి గారు 3 లక్షలు తీసుకుని సర్జరీ చేశారంటని అంటున్నారు తప్పితే ఇప్పుడు దే నాట్ రియలీ ద ఓల్డ్ respect and trust that they had on the medical professionals has disappeared. And I think it's because of multiple factors. One is, I think, just what the media is carrying around. Now, just you talked about the pandemic, and you know the services that were rendered by the medical professionals during the pandemic. They risked their own lives. More than 2,000 doctors lost their lives during the pandemic. Yeah. But I know of at least a couple of channels who ran continuous stories on the negative side about the medical professionals in the pandemic and created mistrust amongst the public. And then we have the famous movies which are even quoted now about how doctors can behave and how hospitals can behave. Then this whole environment of mistrust which has been created has actually been responsible for many of these attacks. And second thing is there is a interest, some sort of a malified interest which is there in which you can actually, when you do a root cause for any of these incidents happening anywhere in the country, there would be a root cause. It could be either a commercial root cause, it could be a political root cause, it could be just a gimmick root cause, whatever. There is a root cause for it. And ultimately, when you do the complete analysis, you would understand that it is an environment that's been created around the medical professionals and the medical profession, which is responsible for the current status. And some of the most experienced doctors on the panel, and I think they would be able to elaborate more on this.
Okay, that's amazing. So, one thing here, because you mentioned about it, it looks like you're suggesting that there is some amount of some kind of organized crime that is part of this.